All right, I will turn it over to Jeff. Here, just a second. All right, there you go.
Thank you, Beth, and thank you for inviting me. My name is Jeff Weinberg, and I am a nationally certified healthcare patient advocate. I've been in the field for well over 25 years, and I've been a director and planned and implemented various healthcare services, primarily working with the aging population. However, I also work with the population that has disabilities as well. And as you see, the name of my business is called Caregiver Champion. And the reason why it's Caregiver Champion is that I actually spend probably more time working with the caregivers than I do with your relative or patient. So anyhow, I thank you for attending. I see one person on Zoom. Is there another person, or is she?
There's about three.
Huh?
There's 3 or 4.
Oh, 3 or 4. So the people that are on Zoom, if you have a question, you can either write it in the chat box that's down below, or you can just shout it out. This is a very informal, formal discussion. Most recently, which has been in the past year or so, I did write a book, and it's called The Emperor Needs New Clothes, or Why Caring Has Disappeared in Healthcare. And part of my presentation is going to explain what has occurred in healthcare and why it's so important that you learn to be your own advocate. Would anybody just like to volunteer, because I'm not going to go around the room, to say why they're here today?
I'm here because I'm a caregiver, and she's 92, and she's very, very hard. She seems to be sweet at first, then she can be very vicious. So
that's your mother?
No.
Oh, you're a caregiver. Oh, you're a paid caregiver. Okay.
And she has no God in her life.
So
I try to turn on God, and she don't want to hear it. So that's very
each person has the right to decide how they want to live their life and what they want to believe in. And it's hard to try to influence someone with something that they don't want to do. And you know, your mission is very admirable, but as an advocate, one of the things that I've learned along the way is that I give people choices, and I give them alternatives. And basically, as an advocate, my role is to help people ask the right questions. Because usually in healthcare today, nobody really has a lot of time for it. And everything is sort of what I call in silos. The doctor's here, the nurse is here, the specialist is here, and they don't usually talk to each other very well. So learning to ask questions is important, but most people, and even including my wife, just because we've been together for a long time, she gets very intimidated when it comes to healthcare, and she doesn't know what questions that is. So with that in mind, as an advocate, I ask the questions so that people know what their alternatives are, and then they make the decision. I don't make any judgments about what people do or don't do. It's their life and they have to choose to live it. Now, sometimes I think, based on what I've told them, that they're not necessarily making the right decision or judgment. But usually, if that's the case, they have to learn the hard way. There's no way that I can make them do what they want to do, what I want them to do. Nor am I there for that opinion. I'm just telling you what you can do and what is reasonable within the realm of healthcare. And then it's up to you to go from there. I see there's a chat one. Is there a question from that?
Yeah.
Oh. So tell me how I do that.
If you just take the mouse and you just click on the chat box.
Okay.
Just take a click, like, double click.
Huh?
Double click.
A double click? For my parents, they moved into Concordia Personal Care Home. My dad is at the highest level of care. They have been there just a little over a month, and my mom has dementia. Who?
That's from Beth.
Huh?
That's Schmidt.
Oh, I'm sorry. So what's your question, Beth? Or are you just you're just telling us what you're here for?
Yes, I was telling you what I'm here for, and
Okay.
it's just a big, like, hard to get used to it because I was the primary caregiver. And then, they had to move in there because with my mother's dementia, she just wasn't good. So it was a little bit of an adjustment, but we're getting there and the place has been excellent. But, like with anything, you still have to be your advocate.
Absolutely. And as we move forward, I'll talk about that some more.
Thank you.
But anytime you're dealing with your parents and you, especially as they start to become more impaired, it's a very difficult situation, as well as, especially if they're moving out of their home and then moving into a new environment, that in itself is an adjustment. So each of those is a big issue to try to deal with. So thank you for participating and coming on with me. So to move the slide thing, I just moved the arrow.
Just yeah, you just hit space bar. That's gonna be like actually just click probably to the left. So take the
I'm sorry.
okay.
Each one of these is a little different.
It's gonna take this. And click on the corner.
Okay. That's the book. And it's available at Barnes and Noble or
Amazon.
huh?
Amazon.
Amazon. And I'm not supposed to sell it here, but if you have my email and you email me, I can send it to you if you want to buy a book. Okay. So all of us, I believe, are old enough. I'm not sure if you are, but Dr. Welby was on television. And Dr. Welby, I think your slides should be, or maybe they're not. Dr. Welby was a doctor who really was a very caring, loving and person. He would visit people in their home. They couldn't afford to pay, they would give him chicken, whatever the case may be. But today, that is very rare. And the average doctor spends less than 7 minutes with you in their office. When a doctor visits you in the hospital, I call that a wave by. They go, hi, how you doing? Okay, bye. Or they see you at 5 o'clock in the morning because they're making rounds, or they see you at 11 o'clock at night. And you are just totally exhausted from the day. And again, you don't have enough time to really engage in a conversation. Okay. So take this back.
Other corner.
Here?
If you're trying to go back a slide, yeah.
Yeah. So that's all went forward. We had a lesson in this before we got started. Okay, next one. So what is the reason for all of this happening? And the reason has to do with money. And you see the big bag with money with a dollar sign. Or you did see it. Thank you. Okay. So the history of healthcare has to deal with several things. Initially, healthcare was religious based. People that were a certain religion, they went to whatever the religious group set up, and that's where they got their care. And then as we move forward, I believe it was 1965, which really isn't that far along. There was Title 18 and Title 19 of the Social Security Act. And that established Medicare and Medicaid. So prior to Medicare, hospitals and nursing homes and doctors all got paid on what's called retrospective reimbursement. And what that meant, and some of you again are old enough that you probably remember this because you used to have what was called major medical, or something that paid for your health care. So retrospective reimbursement means that we'll take an aspirin. It probably takes a penny to buy. When you go to the hospital, the pharmacist now has taken that aspirin and put it in a bottle, labeled it, and sends it to you. In the meantime, the aspirin gets sent by somebody, puts in their med cart, a nurse gives you the aspirin. So all of those people that touched that aspirin, which is now in a bottle, they used to charge for. So that penny aspirin cost on a medical bill $10. And maybe go, how is this so expensive? And along with that, I can give you, and I'm not sure if this is in the slides or not, but when I was a high school senior, my mother had a heart attack. And she literally was in the hospital for 3 months. When I ran a facility that in Westmoreland Hospital that was basically called a transitional care unit. And people who had heart operations were in my facility in 4 days. From there, they spent a week to 2 weeks getting rehabilitation, and they went home. So why did that change? Well, it changed because of the reimbursement system, and I'll go back to it in a minute. The reimbursement system went from retrospective cost-based to prospective reimbursement. Getting back to the cost-based, so the hospital, and I'm making up figures, but we'll just say the hospital got paid $10,000 a day for that person, like my mother, to be in the hospital. So there was no reason to discharge her. So she literally was there 90 days at $10,000 a day. That's a lot of money. Okay. So when we go to a retrospective system, the retrospective system is such that they're no longer based on costs, they're based on other things. Hospital has what's called a DRG. Okay. The hospital DRG stands for diagnostic related groupings. So the DRG is that, wait a minute, we can't afford to have Medicare pay for all of these costs per day. So we're going to do what's called and there were studies done in Princeton and some other places based on what would be the average length of stay for every diagnosis possible. And the length of stay had to do with, so if you had a heart attack today, your average length of stay is actually 4 nights. Now, the hospital gets paid for the 4 nights, and so the average now is probably about $50,000 for the 4 nights. Okay. However, if that person has to stay an extra night, it's still $50,000. It doesn't change unless you have added problems to that cause you to be in the hospital longer. If you get out in 3 nights, the hospital gets paid $50,000. So it's based on the diagnosis. Okay. So again, like I said before, my mother was in the hospital for 90 days. The people that, when I ran my program, they were in the hospital 3 or 4 nights and they were out. And transitional care unit was a remote cardiac facility. So we can use the same example with births today. So my daughter Jessica, who some of you may know, her first child, who's now 17, Elia, she was born at McGee Hospital. Jessica stayed there with Elia for 3 nights. The first night, they gave Jessica and her husband a steak, white tablecloth dinner. And then she went home after 3 nights. So then when my second granddaughter was born, and that was only 3 or 4 years later, and her name is Mariah. Mariah was in the hospital with Jessica 1 night, and she was discharged with my daughter, Jessica, and she was given a package of crackers to go home with. So within 4 nights, there was that big of a difference because the DRG changed, okay? And so as a result of that, the length of stay changes. And for a number of you who have dealt with relatives or whatever, you know, the hospital says discharge is starts the day you come in. And in fact, it does start the day you come in. They want to create a plan and get you in and get you out as quickly as possible. As an advocate, one of the things that I do with families is I am able to determine, you know, if the family member doesn't feel they're ready and, you know, the person appears not to be ready and they're going to be going home without any care, I'm the one that person says, you aren't going to discharge that person. And they go, you can do that? And I'll go, oh yeah, because this is an unsafe discharge. And then we have to go from there. So Medicare is broken down into Part A, Part B, and or Medicare supplement. Part A Medicare, and I'm going to get into this more extensively in one of my other talks, but Part A Medicare is for inpatient care. So when you go to the hospital, when you go to a nursing home, Part A Medicare is covered. Part B Medicare is covered for outpatient care. So when you see your doctor, when you go for tests, those kinds of things, they're all covered under Part B Medicare. And then a Medicare supplement is through some kind of an insurance plan. And they pick up the bill that Medicare Part A or Part B doesn't cover. And in this situation, AARP has a Medicare supplement. There's lots of other places that you can get one. I think AAA or, yeah, has a Medicare supplement, that kind of thing. So the next part is managed care or managed cost, or it's also called advantage care. And managed care in many instances is very good. They are all inclusive in that you not only get your inpatient, outpatient, and medications paid for. So, and you have very small co-pays along with those kinds of things. As also, but the managed care actually becomes managed cost. So again, Medicare, you not want to continue to pay for people's care. So they initiated with other health insurance companies to say you can set up your own Advantage plan. And they seemingly turn over their Medicare to that insurance plan. But what happens is that you're now limited to whatever that plan allows you to do. So for example, if you're in the UPMC Advantage plan, you can only go to UPMC doctors and hospitals. If you're in the Highmark Advantage plan, you can only go to Highmark doctors and hospitals, because UPMC and Highmark don't play well in the sandbox. And other plans have various options. The other thing that you need to understand, and some of you who are Zooming, I'm not sure where you're at, but for example, there's, the snowbird population, and they go to Florida for the winter. If they have a managed care plan, it may not cover the health care in the area that you're in. So they will cover emergency room coverage. But if you need extended health care there, it would not cover it unless you know ahead of time that, whatever system you're involved with is covered through your insurance plan. Another point is that from, I believe it's like October 10th to December 15th, you can change your healthcare coverage free. And my recommendation is to always go to somebody who is a health insurance expert. Don't call UPMC and say, I'd like to change my plan, because they're selling their plan. So a health insurance expert knows what plans to go to based on basically what your medications are, because that's the biggest expense in a lot of different ways. So Medicaid is based on low income, and it's on based on what I call poverty level. And at this point, Medicaid pays for your care, except again, if the doctors or the facilities don't take Medicaid. And then you're again limited to what you can get in terms of care. I gotta go back again. I'm sorry.
Hit the backspace key.
It what?
Backspace key.
Here?
Yeah.
There now is another type of health care, which is now called Obamacare. And Obamacare is care that sort of, at one point, there was 30 to 40 million people of the population that had an income that was higher than Medicaid, but could not afford health insurance. So Obamacare came and developed as a result of that so that people could have health insurance. And that became extremely important for that gap of people. So let's talk about how to be your own advocate. First of all, if you're going to the doctor, you should prepare a list of questions. And the questions obviously are related to whatever your health problems are. It should be giving you what you your medications are, what was your last lab test like, things like that. The other thing is that you should take a family member or friend, and a family member or friend is there because, again, some people are nervous. They they're not sure what to ask. They don't necessarily understand what the doctor tells them. So having a family member or friend with you helps that occur. And a family member or friend should be writing down the answers to your questions. And the three questions that are asked are in your handouts. And the basic thing is, what are my main problems? What do I need to do about it? And why is this important for me to do this? Okay. Now, remember, the doctor has you for 7 minutes. And you may get a nurse, you may get a nurse practitioner, and they're perfectly fine in answering your questions. But you really want to have that doctor stay there longer than the 7 minutes. And so what either you or your family member or friend should do is say, doctor, I'm not finished answering your questions, having you answer my questions. So I need you to please stay here a little longer. Okay, so notice I have an admit person. I go here and click on it.
Yes.
Hello, did you get admitted?
Yeah, she's.
Okay, thank you. So anyhow, you want someone there with you to write the questions down, the answers down, and also to make sure that that doctor stays there until all of your questions are answered. So being an advocate in the hospital is equally as important. And what we're looking to do, again, is that it's important, and this also is in nursing homes, it's important to have someone show up.
I want to know by now we want to talk about
Mary, can you? Perfect. Thank you.
Thank you. So it's important to have someone show up, even if it's for a part of the day, because this way the staff knows that someone's looking in on her or him. Again, we're going to write the questions down. And every day, as you're in a hospital, you're going to have other questions that you need to ask. The other purpose for having someone there, and we've all experienced this, is that you put your call light on and it takes a long time for someone to answer. And it may be that you have to go to the bathroom, you may need a nurse, you may need something, and it just ain't happening. So for example, I visited someone in the hospital yesterday. She had back surgery and she was in considerable amount of pain. I knew what pain medicine he was on. However, it wasn't enough. So I, as an advocate, went and asked for her nurse. The nurse came in and we talked about her pain. And the nurse informed her with me there that not only could she be on the pain medicine, but she could be on a muscle relaxant, which would help with the pain. And those are the things that most people in a hospital that are patients, they just don't know, you know, again, what questions to ask. The other thing is, and my mother-in-law, who's passed away at 97, she was in the hospital like 7 different times. And first of all, if she pushed the call button, she couldn't hear anybody that was answering her, okay? So people just wouldn't come in. So if it wasn't for my wife being there or me being there a large portion of the time, she would have had nobody take her to the bathroom, nobody do what needed to be done. So an advocate in the hospital is not just there for their visit, but for the doctor's visit, but they're there to not only help you, again, get the answers to your questions, but also to get help for you when you need it. And, you know, people go, well, I don't want to bother them. Well, that's why you're there. The nursing staff and whatever are there for you. I was at Shadyside Hospital one time, and this woman needed extra pillows. And I asked the nurse or nursing assistant, I said, she needs extra pillows. This is Shadyside Hospital. She said, we don't have extra pillows here. I said, you're telling me that UPMC, which has a $1 billion in their treasurer, does not afford extra pillows. And she said, I have to tell you, it's really a really hard time to get. So being an advocate, like, I'm sorry, I don't really, I mean, I care that other people don't have them, but I'm here as an advocate for this particular person. And I said, I really want you to find an extra pillow. And they did, okay? Yes.
If you're a family member and you say to the nurse the same thing, do you have more clout than that? I mean, than the family member? I mean, why do they do it for you, but not for a family member?
Because the family member, if the nurse says, we don't have extra pillows, the family member usually just accepts what's been said. So if the family member then takes it to the next level, they're going to say, I'm sorry, I really want you to get an extra pillow. If the family member can do that, that's perfectly fine. In fact, that's what I want that family member or friend to do. I want them to be on the lookout for your friend or relative or whomever that's in the hospital.
I think, from a family member's point of view, they don't want to rattle the cage of the staff too much because then they feel they're gonna get worse treatment.
Well, you know, that is the most common reason why people don't want to do that. But in reality, then, first of all, nobody is allowed to give you worse treatment. I mean, I know people sense it or whatever, but they're not allowed. And they can be reported for not giving you the treatment you need. The second thing is that, again, you as a family member, the only person you're looking after, which is why you're here in the first place, is to make sure that your relative gets the care they need. And yes, people are hesitant, but I can tell you, the more that you insist on something, the more that it's going to happen. And when you don't insist, it's just like, oh, okay, goodbye. And they sort of blow you away.
Well, the other issue is a family member may not be able to visit on a regular basis.
Exactly. And again, if you have a neighbor or a friend or somebody else that can visit, that's as important. The other piece to that is that, again, that's sometimes why you hire an advocate, because an advocate is there and visits that person in the hospital. The other thing is that and this happened actually after COVID or during COVID, about 50% of the people that I see now, their family members live out of town. And I saw someone as far away as Scotland, as far away as Canada. And I kind of call it the boots on the ground.
The what?
The boots on the ground. We're the eyes and ears for that family member. And we help people so that, again, when we talk about caregivers are stressed to the max. Whether you're in town or out of town, it just is a constant worry. And in this situation, having someone be there, being their eyes and ears, giving reports back, it makes a big.
The other issue is since COVID, hospitals are very short-staffed.
Yes, they are.
And that's a real problem.
It is a real problem, but it's their problem.
Not necessarily, not if
Well, again, if you have to go to the bathroom,
that's your problem.
that's your problem. But you know, the only thing they would, if they're not taking you, it's a bigger problem.
Yeah, but it's
because
one to solve.
Because you can end up with an infection, you can end up with bed sores,
End up falling.
and you can end up falling because you're trying to go to the bathroom yourself. So my issue is, and I totally understand that in many instances, hospitals and nursing homes are short-staffed.
When you're there, how long do you stay? I mean, how?
If I'm there, or you?
So if you're hired, how are you hired? Like, are you hired to stay the whole day, the whole night?
Not usually. Not usually, although I have stayed with people in the emergency room for 4 or 5 hours.
It's a tough one too.
But I have typically stayed with someone for an hour to 2 hours and make sure that everything they need has been taken care of. Like for the woman that I saw yesterday, she really was in excruciating pain, and knowing that she was gonna get muscle relaxants made that situation.
Are you allowed with the parents, with the family's permission or the patient's permission to have, to call the staff and ask them questions and stuff?
Yes, the family has to, the patient or the family has to give me permission. And there's two things. One is the HIPAA, which is the Healthcare Privacy Act. And so technically, if you call and say, you know, how's Beth's care? They're not allowed to answer that. In fact, they're not even allowed to acknowledge that Beth's in the hospital. So that's the HIPAA. The other thing is then a release of information. So they have to give permission for me to know about and be an advocate for that
Even
kid.
a family member, they have to give permission, right? Even if,
Yes, if the person's alert and oriented, and it doesn't matter whether they're power of attorney or whatever, if that patient is alert and oriented, the only information is given to that patient.
but the patient can request a family member be,
Absolutely,
and then they have to give the information.
absolutely. In some instances, this isn't all of places, but UPMC, for example, in their hospital system, if you call and you say, you know, how's my mother doing? They usually have to, they ask you a code. So the code could be, you know, 4123. But if they don't know the code, they won't tell you about how your mother's doing. Any other questions about this? I mean, it really is so important. And the last piece on this, hello and welcome. The last piece of this is, do not let someone tell you that you're ready for discharge and you're not. You're shaking your head going, how can they do all this stuff?
You can't, without an advocate like you or a parent, someone intervening as a patient, if you say I'm not ready, the doctor, I guess it's up to the doctor basically, but I mean, I guess it's up to the doctor then to order so it has to do with your rapport with the doctor basically, but I don't. When I had my baby years ago, McGee, it was a weekend and they wouldn't give my kid a bath because it was a weekend and they were short-staffed. And there's nothing that I was able to do. My daughter came home with pustules from not being bathed after she was born. That's how much they can neglect.
That's awful, and that should not have occurred. And again, your husband or whomever should have insisted that baby be bathed before
they get a lot of money.
Pardon me?
They get a lot of money, like you said in the beginning. That's.
I mean, that just is poor care.
Yeah.
And at which point, again,
too.
the hospital has what's called a patient advocate. But the patient advocate for the hospital works for the hospital. So but if you have a complaint like that, in fact, you can say, I'd like to have the patient advocate come up because this is not the right way to provide care.
Well, they said we don't give baths on the weekends. That's just it.
I'm sorry?
The staff said we don't give baths on the weekends because we're short-staffed, basically.
So what happens if, and I'm being sarcastic, but what happens if someone dies on the weekend and they just leave the body in the bed? I mean, it's like, what are you talking about? It's like, that doesn't make sense.
It doesn't.
I wonder what would have happened if you said, I'm gonna do it myself.
I think I asked if I could bathe her in the hospital myself, and they said no. No, you're not allowed to.
I wonder if you had argued with them.
Well, the other thing is.
Me coming from a
what about-
perspective of being an arguer,
Yeah.
that I would have been like, she's
Exactly.
getting a bath one way or another, it's either going to be me
Well,
doing it or you.
Exactly, that's part of
And
being.
again, it's gonna be what?
I said, this is coming from someone who is an arguer, that I would be like, she's getting a bath one way or another, and it's either going to be me or you, your choice.
Oh, well, good luck with that. I mean, what would you, what do you do? Beat her up? I mean, what do you do to?
No, I mean, like, for me, for an example, like, I was there when one of my friend's children were bathed for the first time, and like, you could also, nowadays, you could look it up online to see how it's done. But I mean, if you give your baby like a sponge bath with a warm washcloth, I mean, that's.
Oh, yeah, but I mean, you still have to have the water and you have to have access to some stuff.
Did you not have
No,
a sink or a bathroom attached to your room?
you know, it goes way back. I don't remember that, but I just remember that,
Well,
you know, I didn't have, and plus, you know, I just had a baby, but it wasn't enough to say, you know, I really insist that you give my kid a bath, because look at her, she's like dirty. And I'm not, you know,
Right.
I'm not
well,
up
that
to,
is correct, I mean, she, not necessarily to give the bath, but to say, I insist that my baby gets a bath. The other thing you could do is call the doctor. And the doctor,
And I guess today probably the like waterless wipes that are at least like.
oh, yeah, yeah. Well,
yeah, but that, I don't think that's what's he's saying.
No, I'm just saying like.
I mean, and I also felt that was part of, that I felt they owed me that.
Of
for
course
charging
they
me.
did.
And
Of course
they're
they
supposed to be taking care of my baby.
Of course they did. So, you know, A, you insist. B, if you have, you know, your husband there, he should have insisted. C, you can call the doctor. And D, you can call the hospital patient rep. But all of those things is poor care. And it's neglectful care.
My mother was in the hospital. There was a lockdown at, I think it was Mercy Hospital, and I was not, my mother was from out of town. They kicked the family members out of the emergency, you know, she had a room there, you know, she was in the emergency room already, but they said we had to leave because so there was a stabbing of some people, and they were taking care of these other victims, and they just let her rot there until she had a heart attack, like 24 hours. And then she was intubated and, you know, on a respirator or whatever. And my brother's a doctor, by the way, he's a psychiatrist, but so, you know, the family came in because she, you know, they couldn't get her off the respirator then. And the doctor said, you know, your she was like 87. The doctor said, he recommends that we take her, you know, like kill her basically, because she's of the age where, you know, she's just gonna have more and more problems, and it's gonna be very rough, and not the quality of life, you know, that would be great. And even my brother is a doctor, I mean, and the whole family there, nobody wanted to make that decision, you know what I mean? It was an awful situation, and I was thinking, well, my brother's a doctor, what is he didn't say a word, like my brothers were leaving it up to me, basically, because they didn't want to do something that I didn't want to, they wanted me to do what I wanted, basically, they were leaving it up to me. And no, you know,
so there is what's called an advance directive or a living will. And those pieces of paper are issues about what does that person want in the case that they're no longer.
I don't think she said if I'm leave it up to my kids, or I don't want to live if I'm
did she
respirator.
she may not even have an advance directive.
No, she didn't, but I was, you know, very young. I mean, I'm not young at the time, but I mean, it's a very difficult situation for the first time to be. But I didn't even know a doctor would even say that to you. In other words, I thought that is so bold for a doctor to suggest that you do that. I mean,
Well,
it was
actually,
encouraging.
they have the right to say that.
I know, I was
They
just
want to
surprised.
inform you of what now might happen. But the key, and again, if you don't have an advance directive or you have a parent that doesn't have an advance directive, go get it now.
Yeah.
Because it's that important.
But he didn't say you have the option to, you know, do this if you think your mother is going to have a quality of life or whatever, or what, you know, if she would be happy not having the quality of life. He didn't say it that way. He was saying, basically, this is what I recommend. And I was just surprised that they
But,
would go that
again, his recommendation, it's like me, although I'm not a doctor, saying, here's what I recommend. You have the choice of not doing that.
I didn't know doctors did that, though. I was just
Absolutely.
you know.
Some doctors are better than others.
Yeah,
Well, what you're trying to say is, I notice in nursing home, people run over you. There's bad behavior out there. So yeah, I see it in nursing home.
I'm not saying it was a bad, I don't know if it was, he really, you know, as a physician and his experience with patients, he really felt strongly that if the patients are going to have the quality of life, you know, then it's best. And
I understand what he's saying, and he could absolutely
believed it. I mean, that was his
believe it.
true commitment to
But
encourage.
again, you and your family don't have to follow
I
that.
know, but what a tough decision to make.
Yes, okay.
That's all
But,
I'm saying.
If you don't have an advance directive, please get one. And it's that important. Because I'll give you an example. Because I've been in healthcare all my life, I have an advance directive that says, if and when my quality of life is compromised, whether it's mental or physical, I no longer want extensive care.
And the other issue, yeah.
Finish. Okay.
Yeah.
So my daughter, and Marvin knows who my kids are, my daughter is also in healthcare. And so I have her as my medical power of attorney, not my wife, because it's that hard of a decision. My daughter doesn't like me that much anyhow, so no, I'm kidding. But so then my son, he's very religious, and he lives in Israel. And he totally does not believe of taking anybody off of life supports. He believes that it's in God's hands, and God will make that decision.
But I guess even more important, I guess, and I sort of, the reason I brought this up was, they wouldn't let me be with my mother, and she was there all by herself, and I had a right to be her advocate at that time, and they wouldn't let me.
Who's that?
Emergency room. They said they kicked everybody out of the emergency room that was family. And what do you do then?
I don't know the situation.
No, I'm telling you, it's called a lockdown.
Well, I understand that situation, but
You're not allowed to be there.
I understand that. But again, if your mother's death is imminent,
Well, I mean, that at the time it wasn't.
we need to move on. So
I mean, what do you do in that situation?
I can't tell you because I really don't know specifically what that's.
I mean, do they have the right to not allow you under
In
any
this
circumstance?
lockdown, it means that people that are in that area are in danger.
Oh, yeah, I see.
So clearly, they would not let someone
I see.
be there.
That's what I was asking.
But my mother-in-law died during COVID. And in fact, on March 13th was the beginning of COVID. That was the day. It was a Friday the 13th. My wife visited her mother every day until then. And then when COVID came, all people, family members were told they were no longer allowed to visit. So within 2 years, not 2 years, I'm sorry, within 2 months, my mother-in-law, who was very healthy, deteriorated and basically became failure to thrive, and she died. So a nurse called my wife and said, your mother-in-law is in the last phase. Oh shit, I'm sorry. I'm sorry. Is in the last phase of dying. So she said, well, I'm coming in. And this was like 11, 12 o'clock at night. And they called the administrator, and the administrator wouldn't let her in.
It's horrible.
So she called the doctor. This is where I say you keep going, you don't just say that. And she called the doctor, and the doctor said, of course you can go in. And so the doctor called the administrator, who did not answer her phone, but she went in because the doctor said she was allowed. She was allowed to stay there 1 hour, and she had to leave.
Who gave that rule? I mean,
Huh?
if the administrator answered the phone, who decided that?
The doctor.
Oh, the doctor said, well, no.
And he was the medical doctor. That's
So,
what I'm saying. You don't always listen to know.
so then the staff didn't have to listen to the administrator then last?
No, what happened was the doctor called the staff, said she used to be admitted, she used to be there with her mother dying. The staff called the administrator now. And so, but they let her in. She stayed an hour, and the staff were like knocking on her door saying, you have to leave because we're going to get in trouble. We're going to get in trouble for letting someone die with their family. So she left, and probably not more than 45 minutes later, she died.
Well, also there's the risk of getting COVID and being in the hospital.
Well, but she had fully gowned,
Yeah.
she fully gloved, she fully masked. She was in a room by herself. So
We
yes,
also knew a lot less back then about it.
yeah, but in reality, even if she had gotten COVID, it was worth her while
Maybe.
to be
Yeah,
with her
definitely.
mother
No,
when she
definitely.
was done.
But imagine being alone, being the one that's dying and
Oh, it's
not
awful.
having access to your family. I mean,
Well, being alone is a very, in lots of ways. So I have a couple questions on here. Can I get medicine interstate? Yes, you can, unless it's marijuana. And then it has to be the state that you're in. I don't know if that answers your question or not.
You would have to have your prescription transferred, like your doctor would have to call it in, or like if you go to CVS near your home, you would be able to go to a CVS in like Ohio and say, we
Right.
need you to transfer a prescription.
Right.
would the pharmacy do
Can I
that?
hire you so we can?
Would the pharmacy do that? The
Yes.
pharmacy, your local pharmacy would do it for you.
Yes.
I forgot a prescription while I was in Florida, and I went to the CVS in Florida and said, can you transfer it from Pittsburgh? And they were able to give me my prescription while I was there.
My wife and I were in England because my daughter was there for 3 years and she got sick. She called the doctor at home. The doctor at home called into the pharmacy in England. So yes, the answer is yes.
Psychiatrists do that all the time.
So explain prescribed medicines and over the counter. Well, prescribed medicines, you need a doctor to write the script. Over the counter, you can go anywhere and just buy whatever it is you want. Some of the over the counter meds could be equally as strong, and sometimes you need to know what the side effects are. And in fact, of all your medicines, you should either, again, ask that question to your doctor or ask that question to your pharmacist. I hope those answer your questions. So we're almost finished here. How do I get rid of that?
The little X in the corner of the white box. There, yep.
So how to find a nursing home. So the first thing I tell people is don't go to the nursing home during the day. Go to the nursing home after 5 o'clock because most of the administrative staff is gone. Okay. So now you get to see what that nursing home is really like.
Let you in.
Oh, yeah. You're totally allowed to visit. And you can say, I'm here to see what the facility's like. I was trying to make a decision. Whatever.
I worked with a priest and one,
Where?
a priest. I worked at Kane.
Oh, yeah.
Yeah, I helped the priest. I pushed people down in wheelchairs to mass.
Okay.
So I know what you're saying.
So, second thing is, and I call this because I've been a nursing home administrator in a number of facilities, and I call being in a nursing home, there's what I call a pulse.
Pulse.
Pulse, P-U-L-S-E, pulse. And I can tell in 5 minutes whether or not someone is getting good care or not. So what am I, and people say, well, it's the smell. Well, in today's world, the smell gets covered up. So that ain't gonna be it. So,
Does?
yeah.
Yeah.
I mean, they have ways of.
Yeah, well, you
Not smell?
do. You know, you just spray something and it goes away. So why am I saying that you need to, what's the pulse mean? How do you know what you're looking for? Anybody want to take a guess?
Pulse. Bad care? Is it the
No,
bad care in the nursing
Pulse
home?
means that there's activity
Oh,
and
okay.
interaction. People are laughing. They're relating to each other, the staff, and to the residents. So there's sort of just feel for that these people really are part of the family. The staff feels it, the residents feel it, and you can walk in and you can see it and you can hear it. You can go to other nursing homes and you see people in the hall with their head down or watching a television that may or may not even be on and being in a room. So clearly, those kinds of places, you don't want your relative to be in. The other thing is obviously you get recommendations from friends. And then lastly, and this is very important, so CMS, which is the Center for Medicare and Medicaid Services, cms.gov/nursing home compare. So remember this. You can look up any nursing home in the country and that will publish their star rating. It's like a restaurant, 5 stars are best, 1 stars are worst. And it's based on their Medicare survey by the state on how they do and what kind of deficiencies they've had in terms of care, in terms of safety and things like that. So lots of times people will call me and say, you know, you mentioned Kane, you know, what's the Kane Hospital like in South Hills? And I can tell them to do it, but again, I have a better understanding of what that survey might say. So I would look at their survey, see what it says, see what their deficiencies have been, and then go from there. So that's a very critical piece. So we pretty much have done this. Again, we help navigate the bureaucratic maze. We represent you. We are not employed by the hospital or the facility or whatever. We give you an alternative so that you can make decisions about your care. We provide rights, protect your rights. And this woman of, you know, having her baby go home without being bathed is total neglect. Thank you.
Thank you.
Thank you. Any questions or anything that anybody else might have?
Thank you. Very informative.
Thank you.
Different hospitals, your information to that.
No, they don't want my information. However, there's a number of people that are professionals that refer to me.
For doctors, you like.
Yeah, there's some doctors that will refer to me. I have a newsletter that goes out to about 1,000 people every month. And
can someone who's a healthcare professional get your newsletter then, like a doctor?
sure.
How would they do that?
It says card.
You can did you get my business card? Yeah. You can email me your name and their name and tell me who you want. Again, my book is on Amazon or Barnes and Noble online. If you want it, you can email me and I'll be glad to send you a book.
Let's see it.
Sure.
These underarms.
What? Yeah.
Underarms.
Thank you for coming. If you have any other questions from this, again, feel free to call me or email me and I'll be glad to answer them for you. Just let me know that you attended this class and you need more information. Thank you very much.
Did you know I was in the Holy Land?
Thank you.
Right.
Bye.
I was in the Holy Land. I visited the Holy Land. I was in there.
Yeah.
Yeah.
Good.
With a priest. A whole bunch of us.
Mm-hmm.
Yeah. So your son lives over there?
In Israel?
Yeah.
Yeah.
So is he in the part where they're going nuts? No.
Well, all of Israel's going nuts, but
I think.
he lives in what's called the West Bank,
Oh,
which
okay.
people hear about. So he's not real safe in that area.
Oh,
In the
okay.
beginning, there was bombing in that area.
Yeah.
Now there isn't, but he just told me that if Lebanon gets more involved, that could be dangerous to where he's living.
Wow.
And interestingly enough, people who live there, all of them have bomb shelters in their house.
But they haven't been secure enough to keep the enemies out because they've been killed in the bomb shelters. They've been shot, they shoot through them.
Well, that was when Hamas did all of it.
They're not even safe in their bomb shelters.
It's a scary situation.
I have a question for you. The lady I work for, she has dementia.